Today we're going to talk about the use of psychedelics for chronic pain. This was a topic that was suggested by one of my viewers, Juliette. So shout out to you, Juliette, for suggesting this topic. This is a really interesting video for me to research, and it's not one that I would have thought of on my own, I don't think, because I fortunately don't live with chronic pain. But as I've learned, chronic pain is a huge issue in the US and around the world. According to the CDC, over 20% of US adults live with chronic pain, which is characterized as pain lasting 3 months or longer. Chronic pain carries a public health cost of approximately $635 billion per year in the US, and globally it is the #1 cause of disability and disease burden. To say that we are talking about a pervasive issue is an understatement, and it is further complicated by the fact that conventional treatment methods for this condition aren't without setbacks. Opioids can lead to addiction and further psychological and health problems for some. Antidepressants come with a multitude of side effects, and having your own holistic pain management team can be costly for the gradual improvements you get. This is not to say, though, that conventional treatment methods aren't valuable. They absolutely are and should continue to exist among a wide spectrum of options, but that is the thing. We need to have options, especially when we're talking about an issue as pervasive and as debilitating as chronic pain is. Having a wide spectrum of options should include so-called alternative practices such as the use of psychedelics. So, in this video today, I want to explore the question of how well do psychedelics work in chronic pain management? Unfortunately, the science here is underdeveloped, but not for a lack of research potential. Once again, we run into the age-old issue of the suppression of psychedelic research for almost 40 years, thanks to the Nixon administration and the politicization of science. This means that many of us are left to fill in the gaps and figure things out for ourselves. On this channel alone, I can't even count how many comments from you guys who say that psychedelics are an integral part of your pain management protocol. So I have no doubt that psychedelics work for chronic pain management. The issue is, I can't exactly point to any studies right now that conclusively validate the thousands of personal accounts out there. So what we're gonna have to do instead is we're going to have to make lemonade. I'm going to share with you the research that is available to us in addition to the potential mechanisms at play that might explain the apparent efficacy of psychedelics for pain management. This is probably one of the most challenging videos I've put together because it required me to fill in so many gaps. And so I ask you in advance for your patience as I try to paint a cohesive picture for you. I hope that by the end of this video, you will find that your investment of time will have been worth it and that this video serves to be an adequate conversation starter in this domain. All of my research will be linked in the description box below, of course. With that said, let's get started. And where we're going to start is on the condition of pain. Pain is actually a very complex condition to characterize. For hundreds of years, scientists used a model for understanding pain that was entirely reductionistic. They saw pain as a direct function of the gravity of a physical injury incurred, i.e., the more serious your injury, the greater amount of pain you felt. As intuitive as this model may have been, it didn't tell the full story, and it left millions of people living with chronic pain in the dark. Thankfully, today, we now understand that pain is a condition that involves biological, psychological, and social factors. And I'll give you an example. Stubbing your toe. You can imagine that stubbing your toe feels differently when you're surrounded by friends and family and when you are already in a good mood to begin with, versus if you were in isolation and were already in a bad mood to begin with. It's gonna feel differently in those two scenarios. This is not to say, though, that the experience of pain is any less real than if it were to just be a purely biological phenomenon. Pain specialists know this. They know that the pain that a patient feels is the pain they say they feel. And put into historical context, this is a great thing because at least we're not gaslighting people on the pain that they experience anymore. But it also brings us to our next problem, and that is on the nature of chronic pain itself. Whereas acute pain serves a purpose, chronic pain doesn't, and often the pain can become the disease itself, as in the case of migraines or fibromyalgia. Chronic pain can be the result of nerve damage or acute pain that is transformed into a longer lasting pain by the sensitization of nerve fibers. If pain signals are activated repeatedly, our nerves will adapt to send signals more efficiently. In order to do this, they develop more stress sensors to amplify the message of pain to our brain. This creates a vicious cycle in which its various components feed on one another. In essence, the longer you experience pain, the more sensitive to pain you can become. This complex interplay becomes the new norm in those with chronic pain, and we have the process of neuroplasticity to thank for this. I believe this is one of the reasons why chronic pain is so difficult to treat and reverse. Addressing symptoms can only get you so far, but at some point you have to look at what can be done in order to reverse the oversensitization of our nervous system and or damage to our nervous system. According to clinicaltrials.gov, there are over 200 active and or completed clinical trials studying the effects of hallucinogenic compounds on a full spectrum of health applications. However, none of these applications involve chronic pain. The good news comes from a recently completed placebo-controlled clinical study conducted by the Beckley-Maastricht Research Program in Europe. This study examined the acute, not chronic, pain tolerance of 24 healthy volunteers who were given either a placebo or small doses of LSD at 5, 10, and 20 microgram intervals. The volunteers participated in a cold pressor test in which they were asked to submerge their hands in 3-degree cold water for as long as they could tolerate. The study consistently found that volunteers who were given a 20 microgram dose of LSD were able to keep their hands submerged 20% longer than those who were given a placebo. This is remarkable. 20% longer is remarkable because it represents a magnitude of effect that is comparable to that observed in subjects who are given opioids such as oxycodone or morphine. And now I want to show you something here on screen. This timeline represents a timeline of studies that have examined psychedelics as analgesics, aka drugs that relieve pain. In a study from 2006, researchers interviewed 53 cluster headache patients who were self-medicating with either psilocybin mushrooms or LSD for their condition. 22 out of 26 psilocybin users reported that psilocybin aborted their cluster headache attacks. 25 out of 48 psilocybin users and 7 out of 8 LSD users reported an end to their cluster periods. And 18 of 19 psilocybin users and 4 out of 5 LSD users reported an extension of their remission period, the time until their next attack. The authors conclude in the abstract of that study, quote, "Research on the effects of psilocybin and LSD on cluster headache may be warranted." And I'm like, duh. If there are any benevolent billionaires out there, now is your time to step up and really make a dent in the arc of history. That sounded really cheesy. I'm also really hungry right now, so let's just power through. Okay, now I want to share with you something really interesting that came out earlier this May. In a paper that was published in the journal Regional Anesthesia and Pain Medicine, researchers at UC San Diego reviewed the scientific literature and proposed a mechanism that could explain how psychedelics work to relieve chronic pain. This mechanism involves the ability of classical psychedelics like psilocybin, LSD, and DMT to activate the 5-HT2A receptor, which belongs to the serotonin receptor family. Activating this receptor causes at least 2 sets of genes to become more active: the genes associated with neuroplasticity and the genes that suppress inflammation. As a result, you could get the following cause and effect: a rewiring of the brain back to a more efficient, healthy state, plus a reduction of inflammation in the body equals a reduction of the level of pain perceived. I didn't say it, the researchers did. Now, there's one more point that I want to cover before we wrap up this video, and that is on the relationship between antidepressants and chronic pain. Those of us who don't suffer from chronic pain might not know that antidepressants are commonly prescribed for pain management as a non-addictive, quote-unquote, alternative to opioids. It turns out that pain and emotional distress are more entangled than we might imagine. It's not simply the case that they are comorbid, but rather it appears that they feed into one another. Pain can trigger depression, which makes a person less capable of coping with pain. This relationship is so entrenched that one study estimates that up to 85% of patients with chronic pain are also affected by severe depression. This is probably one of the reasons why antidepressants are sometimes prescribed for chronic pain. The drawback of antidepressants, of course, is that they carry a whole host of side effects, including dry mouth, weight gain, loss of motivation, loss of appetite, night sweats, sedation, you name it, suicidal ideations, you name it. Anyways, who's counting? No antidepressant comes without side effects. Doctors who prescribe antidepressants for pain management are advised to simply do their best to pair their patient with a side effect profile that they are predicted to be better suited for. For example, a patient who struggles with insomnia might do better on an antidepressant that has sedation as a side effect. Dare I ask the following question? Given the fact that antidepressants are sometimes prescribed for chronic pain management, and we are now seeing how effective psychedelics are for treating mood disorders, especially when compared to conventional antidepressants, could it be possible for psychedelics to be used in place of antidepressants for chronic pain management too? This is an area that science is yet to explore, but hopefully that will change in years to come because we need it. In the meantime, I want to leave you with a personal account. I made a video earlier this year in which I talked about my experience tapering off an antidepressant. In that video, I shared with you that I've essentially spent over half of my adult life on some sort of antidepressant. And the fact that I've been able to be off antidepressants now for almost 2 years is a remarkable achievement for me. I don't believe I would have been able to do it had I not discovered microdosing. And now that psychedelic medicine is in my arsenal of resources, I don't expect to ever go back on conventional antidepressants ever again. This is how strongly I feel about the potential of psychedelic medicine. For me, microdosing doesn't come with any come down or withdrawal. Psychedelics aren't addictive, whereas antidepressants are. And I know it's not printed anywhere in the brochures, but they are. If you can't simply quit cold turkey, if coming off a drug causes you to experience withdrawal symptoms, that suggests that on a chemical level that your body requires that drug. I don't mean to come across as anti-antidepressants at all. I'm simply speaking from my personal experience about a personal choice that I've made for myself. But this is where we have to go back to a point that we touched upon earlier in this video. What we need is to be able to have as many options as we can have so that each one of us can make an informed decision about what is best for our own treatment. That brings us to the end of our video. I don't know if you've noticed, but I am now able to serve ads on my videos, which is a huge step because in order for me to continue to do this, I'm gonna have to figure out how to get paid for it at some point. So getting approved for monetization is exciting, but this probably doesn't come as a surprise to anyone. A bunch of my videos don't qualify for monetization because of the subject matter that the videos are about. Whereas in the past, I might have just politely asked you to consider giving this video a like and leaving a comment for the algorithm. It'd be very nice if you could, especially if you want to see more videos like this in the future, to just give it a like, give it a comment, and I will see you guys next time.